Why RP patients develop cataract and how can we manage it early? Do you have RP and vision is already dull? Then cataract could be the problem. But here's why and what you should do and you can do. In retinitis pigmentosa, the retinal cells slowly degenerate, producing more oxidative stress and inflammation inside the eye. This affects not just the retina but also the lens, including the posterior subcapsular lens mainly. And it makes it cloudy, the vision becomes cloudy, and the RP also starts developing along with it, making it even worse for people even at a younger age. So why it happens? It's because of increased oxidative damage in the lens and in the retina. So chronic inflammation from degenerating retinal cells also could be one reason, and long-term use of steroids or supplements sometimes adds to the risk. So how do we tackle it? Maybe we can use antioxidants like lutein, zeaxanthin, vitamin C, omega-3 fatty acids if it is very mild levels. Protect our eyes from ultraviolet light, glasses and blue light exposure. Keep regular eye checkups and early cataract removal with micro incision cataract surgery can restore clarity and improve the useful vision in RP patients. At Dr.Sasi Eye Care, we combine cataract surgery with retinal support therapies like photobiomodulation, stem cell therapy, nutritional neuroprotection to preserve and enhance the remaining vision. So RP patients need light and science can help keep that light alive. Thank you, dear friends. Dr. Sasi.